So let's see, we're doing today, or you did today, a PRP treatment, and we're doing right now a laser, class 4 laser. How did it feel, Brian? The whole process?
I mean, I was very nervous about the PRP initially because was sensitive. I'm very sensitive to needles, but my concerns were alleviated by talking to a couple of my friends who have come here and had the treatment done, and they also assured me, the doctors here, that they weren't going into the tendon. They didn't want to rupture it or weaken it. They were going to inject around it very carefully and sterilize everything. And they did a wonderful job. It was not nearly as painful as I thought. I thought they were going to stick a needle 3 or 4 inches into my foot, into my heel, alongside the tendon. And what they did was, inject the needle maybe, I don't even know how, but just an eighth of an inch, a 16th of an inch, something like that, and inject the platelets. And I felt just a tiny bit of pain. I'd say 2 out of 10, 3 out of 10. And they did the one that wasn't as bad first, the right foot first, and then they did the left foot next. And actually, the right foot hurt a little bit more than the left. I mean, they both hurt just 2 to 3 out of 10, but it lasted about 30 seconds, and then it was over. And they did a great job of, I didn't look at it, and I'd have to say that, it's more just about relaxing and breathing and just letting them. They're the professionals. We're all kind of nervous because we have an absence of knowledge that they have, and in the absence of knowledge, our worst fears are what we think about. So
yep.
Overall, I'm excited to take about 4 or 5 days off, and then ease back into training and get ready for Boston, which is in about 38 days, or I think 40 days, April 24th. So I'm excited to be able to walk normal again in about a week after having this work done, and we'll follow up with some additional therapies, and I'll be smart to get back, do some aqua jogging first and elliptical, and then get back into easy road running maybe about 6 days from now or so.
Cool. We're all looking forward for the results. Yeah. So, Dr. Dressel, so what are you doing right now? You're playing with the...
I'm doing the laser right now after Yvonne just finished using the ultrasound and finding exactly where we want to put it. I'm just stimulating the growth factors that are in there, the cytokines that activate to do more work. So we're using actually technology, a class 4, 10 watt, 940 nanometer laser to basically do photostimulation, light therapy.
Okay. Is that painful at all, Brian? Laser?
No, I mean, it's only painful if he stops moving it, but it feels warm and it's a nice feeling. I would say it's not painful. It just is a little warm, and that's good because it's warming up the tissue. I would say it's not painful at all.
Cool.
I just have a little bit of pain just from the hard workout we did last night. We did 7,100, so my body's still throbbing a little bit, and I'm still trying to get back to reality. But overall, I'm just excited now to have this. Now I'm in the healing phase, and I can just relax, and there's nothing else to do except just relax, right?
Yeah, exactly. I'm going to use a little Visco tape there.
Cool.
Just to loosen up the tension.
And Doctor, you want to talk about the PRP? Just a quick... How does it work, and how your body can heal, and how natural it is?
Sure. So what we're actually using our own blood. We're not using medication. And what we do is we extract the blood, and then we spin it down, and we concentrate. We take away the red blood cells, not because they're harmful, just because they're useless in this scenario. And then we take it again. We take the plasma with the platelets inside, we spin that again, and then we concentrate the platelets at the bottom. So then we extract the platelets with plasma, and we inject it right into the injured site. And what that does is the platelets have 2 functions. The first function that they do, we always think of blood clots. They stop the bleeding. They flow to the area that's injured, they stop the bleeding. The second function they do is they release all these cytokines and essentially all these growth factors that promote healing into an injured site. And along with that comes, they stimulate stem cells to flow to the area that's injured, along with blood flow that stimulates blood flow and new channels of blood to go to an injured site. And that's how, amongst many other functions, how they stimulate growth healing.
Cool, very good. So how long does it take, the process, the whole PRP and the laser?
So usually, typically just preparing it takes longer than the procedure itself. It takes about 40 minutes to do the double spin method. There's some studies show the double spin method, you get a more higher concentration of platelets. So it takes about 2 spins of 10 plus the preparation. And then the procedure, doing the injection itself, takes about less than 10 minutes. How long did it take?
Mm-hmm.
Yeah, probably 10 minutes.
10 minutes for both feet. And you guys were extra conservative and easing. And
Right, you don't want to rush
spraying
anything
and
always.
Cleaning, and my feet aren't the cleanest.
And then a little trick that I picked up along the way is actually using, for every injection you do, you use a fresh needle, because every time you do an injection, you bent the tip of the needle ever so slightly, and enough to kind of make a noticeable difference in the pain. So if you use a fresh needle every time you're injecting, it takes a little bit, time and resources, but it saves a lot of pain.
Right.
And that made me feel really good when they told me they were gonna. I didn't even think that they were gonna do that, but he told me that walking into the room. He told his assistant Linda, and I was like, wow, I love that.
What's the forecast? How long do you think it's gonna take to heal?
So that's a good question. Textbooks will tell you that it takes about 4 weeks for you to start seeing a remarkable difference. Now, in our experience, we've been seeing it as early as 3 to 4 days.
Okay.
But we do have a lot of athletes that are our patients, and typically you think athletes are much healthier than the general population. So the textbook answer is 4 weeks. In our experience, as soon as 4 days.
Cool.
And
It's
you have
amazing.
to think that what we're doing is we're essentially taking your own blood, your own healing factors, and inject them into an area that's injured. So a big part of this is how healthy the patient, how healthy the individual is. All we can do is introduce your healing factors to the
Makes
injured
sense.
site,
Yeah.
and then really the body does the rest of the recovery itself. It's not a medication. It's not a dosing.
Cool. That's for today.